There's going to be some really important outcomes from this conference. This isn't a one-off. I mean, you know, this has been a process of trying to, this is like the Global Health Network Live, somebody said, I like that, the Global Health Network Roadshow. But we're going to be writing up the PLOS papers to capture all the recommendations. Please share anything you want to from anything that's presented or anything that you've got, you can share on the platform. And of course, we've all made amazing connections. I've heard about so many, I'm sure you all have. We've made new connections and friends, so keep those going. Thank you for that. And so lastly, over to my wonderful colleagues who are going to close the meeting, but thank you, everyone.
Thank you very much, Trudy. First of all, I would like to say I feel honored to have been here this week to participate in this very well-organized and well-spoken meeting. And I'd like to seize the opportunity to clap for everyone who made this possible. So I would say that the Global Health Network was born in Africa, as we all know. It's been around for a while. It's been to places, but now in Africa, it has grown to become a teenager. And we know that when you become a teenager, there are certain responsibilities that you have to take for yourself. So at the end of this conference, we have the birth of the Global Health Network Africa, which means that leadership, coordination, and definition of the way forward in a coordinated manner has to come from the Global Health Network Africa. This does not mean that we are going to reinvent the wheel. It simply means that we are going to do it in a way that is fit for purpose and addresses the needs of our local communities. I think this has come up so many times, and we are glad that in the room, we've got so many people who are going to support us in this journey. And we will do that in leveraging existing networks, because I mean, we've seen so much work that's already ongoing. And then the second part about being a teenager is that you get the opportunity to go out there and talk to your peers. I think in the previous discussions, it was said that boys have the opportunity to talk to their other friends, to learn lessons from them. And we are glad that at the time that the Global Health Network Africa is being born, peer networks of Asia and Latin America are being born. So we really want to talk to each other, learn from each other, share experiences, and move forward. So that by the time we are celebrating out of teenage age, we should not be talking about how many papers or how many data sets we've exchanged, but we should be talking about how much impact we have driven in public health on our different continents and in the world as a whole. And we'd like to thank the funders who has been supporting us so far. It is always said that behind every grateful person is a sacred wish for more services. So we are thanking you because we'll be coming to knock your doors for more funding. Thank you very much, and have a nice travel back.
We were looking for champions. When I met Turi 4 years back, Turi came to me and said in a meeting, Aliya, I'm looking for you. And I was surprised. Why is she looking for me? She doesn't know me. And she told that I'm looking for someone like you who can do things. And that was the beginning of a dream, that to put leadership in global health in a global manner everywhere in the world. And now we are having a conference where we are launching the Global Health Network Africa, the Global Health Network Asia, the Global Health Network Latin America and Caribbean. So the Global Health Network has gone global, finally. So this is a dream that is coming true. And this conference is just the beginning of the journey. And it is a tremendous idea, wonderful idea to announce this journey through this conference. And there is a trick in it. This journey cannot be started without our partners, our other researchers. And we wanted to bring everyone under this umbrella to share what we really want to do, all these 3 regional centers. But without your support, your participation, all these wonderful plans will not work out. So those who came to this meeting without being a presenter, without having been a scholarship, and those also who had come all the way down with all the hardship and also got some scholarship. I really applaud you that you made this conference successful. So it's a big applause for all the participants sitting in the hall and who already left. You made it successful. But this day did not come in a magical way just over one night. We have been working for this for the last 2-3 years. We are doing tremendous job. There are small teams behind all of us, all the regional center. There's a big team. Some of them you sit on the backside, some of them you see out there. And it is the hard work, day and night, relentless effort of those people who supported our team. So rather, I've been thanking Trudy. I think Trudy and I convey the heartiest gratitude to all of you who are the workforce of the Global Health Network, all this region and the UK, who made this conference to happen and made it a successful one over the 3 days event. So a big applaud. I would request to give all these people who work behind this screen. Just with last word, this journey started with a dream. I want to repeat what I just said a few minutes ago. We are dreaming of a federated leadership world, and we were looking for champion, I told you. And everyone's present here is a champion. You are a leader. When you go back, you take efforts, you drive your own innovation, your own work, and we, the regional centers, are here to support you. So please join us and knock at us without any shame. Thank you very much.
These were amazing 2 days, and for some 4 days of very, very intense work, because we had lots of pre-conference activities as well. And so this conference was very dense, very intense, and very, exciting. We are leaving with lots of ideas, a lot of inspiration to go on, to move forward. And so I would like to reinforce and thank very much all the group that was involved in the organization of this conference, the Global Health Network team, and the University of Cape Town team was involved in this organization, and also who welcomed us so warmly. I would like to thank as well the scientific committee. This conference was opened by a member, the head of the scientific committee, and their role was very important. And also to thank all of you, all the delegates, all the speakers, all the people who made this such an interesting event. In what regards the Global Health Network, we are very, very proud and happy to be launching the 3 Global South networks. As my colleagues have said, the Global Health Network Africa, the Global Health Network Asia, and the Global Health Network Latin America. And it's very significant to us that it's being made here in Africa. And I'm the last one to speak. And I thank you, all my colleagues. We from Fiocruz are very, very excited about working with our Latin American partners and also with our Asian and African partners in the next year. So we have several different networks in the Global South working together and exchanging ideas, experience, and dreams. And so I'm the last one to speak because I'm supposed to announce that the Global Health Network Conference in 2 years, I mean in 2024, will be in Latin America. So we hope to be funded and to invite people and to have you all there and many other friends and colleagues with us. There is a very healthy competition about the exact place. But I can ensure that you'll be a warm and interesting place and that people will be with their arms opened to receive all of you. And so we will be together again from now to then. We will work a lot and we will work a lot and exchange experiences and build new perspectives to research capacity building in the Global South. Thank you very much. So many different countries represented here. Thank you very much.